Good morning, student. Today we are going to discuss our fourth unit, Physical Education and Sports for Children with Special Needs, that is for Divyang. Concept of disability. Disability, it is an impairment that may be cognitive, developmental, intellectual, mental, physical, sensory, or some combinations of this. Means disability, it is an impairment which does not permit an individual to perform any activity or movement in a normal way. For example, if a person's leg is cut, then the person cannot work in a normal way. Disorders, it is mainly related to body part, and generally disability, it is permanent, it cannot be cured. Disorders, it is a problems or illness which affect someone mind or body. It is mainly related to mind. Disorders uh, disorders create disturbance in an individual performance and reduce his efficiency. In the beginning, disorder seems to be normal, but they usually grow um, and spread in a harmful manners in an individuals. If disorders is not cured, then it cause disability. For examples, eye disorders. Eye disorders means the person is not able to see, and if there is no treatment, then this eye disorders change into eye disability. That is, he will completely blind. He will not able to see, and if he become blind, then it cannot be cured. Type of disability. There are three types of disability: physical impairment, cognitive disability, intellectual disability. Mobility of physical impairment. Physical impairment occurs when structures of bones is affected. Physical disability, disability, it is a disability in physical functioning, like is not able to see, listen, move, is not able to do any movement, etc. And physical impairment, it may be occurs from birth or after a birth during a lifetime. It is generally related to musculoskeletal system, circulatory, respiratory system, nervous system, etc. Like the person is not able to use his upper limb, lower limb, etc. Next is cognitive disability, or we can say learning disability. Cognitive disability, it is generally related to neurological disability, in which uh, the person is not able to store, process, and produce the informations. His mind is not able to store, process, and produce the information. This ability affect an individual to read, write, speak. Okay, and cognitive disability, the person is not able to read, write, speak, etc. He faces difficulty in reading, writing, speaking. For example, if he is learning something, he has a problem in storing, processing, and producing the information. People, uh, this cognitive disability, it is of three types: memory disorders, hyperactivity, and dyslexia. Memory disorders means the person faces difficulty in remembering what he has heard, said, or saw before some time. Hyperactivity means The individuals have not is not able to pay attention for us. Sometimes he find difficult to stay at one place. And dyslexia means the persons face difficulty in reading, writing, speaking, etc. This is about the cognitive disability. Next is intellectual disability. Intellectual disability, it is generally related to the developmental disability. Okay, intellectual disability, it include intellectual or developmental disability in which the person face difficulty in communicating, remembering the informations, learning, making correct judgment, problem solving, etc. The persons the persons uh, the person's learning rate is slowly. He is unable to use the information in a correct way. Cause of disability. The cause of disability may be genetic, environmental factors, or unknown cause like accident, disease, infection, heart attack, etc. Genetic, genetic, genetic like genetic like uh, disability inherited from his parents to the child through gene. Environmental factors. Disability may be due to environmental factors also, like accident, injury, disease, etc. An unknown cause, like let's discuss some cause of disability. Cancer, it is a cancer, it is the cause of disability which cannot be cured. Heart attack, heart disease like heart stroke, heart problems, heart failures, etc. can also lead to disability. Diabetes is also the cause of disability. Diabetes is rising fast along with obesity. Musculoskeletal disability like joint pain, joint disorders, arthritis, musculoskeletal problems, etc. Disease may also lead to disability. It affects the person normal functioning of the body, like the person is unable to coordinate his body movement, blindness, etc. Malnutrition is also one of the big reason for disability. Due to malnutrition, if he does not get a proper nutrients, then it may also leads to disability. What like poison, eating poison, weapon, etc. Pesticides and many other poisonous chemicals are in great use today that cause many disability. Accident, due to road accident also it may lead to disability. Heredity from parents to the next generation. These are the some cause of disability. Types of disorders. First, disorders, it is a problem or illness which affect someone's mind or body. Some types of disorders like attention deficit hyperactivity disorders, sensory processing disorders, oppositional defiant disorders, autism spectrum disorders, etc. These are the some types of disorders. Let's discuss one by one. First disorders is attention deficit hyperactivity disorders. It is a brain disorders in which the person is not able to pay attentions, hyperactivity, impulsivity, etc. It is generally related. To neurodevelopmental type. Attention deficit hyperactivity disorders disorders. It is of three types: inattentions, hyperactivity, and impulsivity. Inattention means the person is not able to focus on a focus on something for a long period of time. uh, he faces difficulty in sustaining focus and is disorganized. Hyperactivity means the person's make a the person is not able to sit in a one place. It may be extreme restlessness or wearing others out with constantly. And impulsivity means the persons make hasty actions that occurs in the moment without thinking, doing the activity without thinking. Symptom of attention deficit hyperactivity, like um, the person is not able to pay attention, excessive activity, he faces difficulty in controlling his behavior, etc. And it is mainly seen in boys, more in boys. And the cause of attention deficit hyperactivity may be due to genetic factors, that is due to genetic factors, brain injury, if there is any injury in the brain, low birth weight, low 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 birth weight, uh, children with low birth weight are more uh, likely to be attention deficit hyperactivity disorders. Brain injury, diet, due to malnutrition, due to diet problems, if he does not get proper diet, it may also leads to ADHD. And its management technique, um, like through counseling, changing his behaviors, changing his lifestyle, medical treatment, medications, etc. Sensory processing disorders. Sensory processing disorders, it is a conditions in which the persons face difficulty in receiving and responding the information that come in through the sense. He is not able to receive. If he does not receive the information, then he will not respond to that information. The cause of symptoms of sensory processing disorders, like the persons does not feel does not the sensory processing disorders may affect one's sense, like hearing, touch, etc. He does not feel any taste, hearing, etc. His sense is no more responding. And the cause of sensory processing disorders may be due to genetic factors, that is from his parents, low birth weight during the child. If his weight is low during the birth, then it may lead to sensory processing disorders. Environmental factors, also the reason for sensory processing disorders, etc. And the management technique, like its management techniques are changing his lifestyle, medications, proper counseling, uh, therapy, etc. Autism spectrum disorders. Autism spectrum disorders, it is a developmental disorders. It is a developmental disorders. The young children with autism spectrum disorders have difficulty. The persons who has autism spectrum disorder, he faced difficulty in communicating, language skill, social skill, behavior, etc. Is not able to interact with the society. He faced difficulty in communication challenge, um, tendency to talk less. Tendency to talk less. He has less social skill. Unable to um, eye contact with the others, etc. And it cause may be due to genetic factors, physiological factors, psychological factors, social factors, etc. And the management techniques, by changing his behavior therapy, physical activity, counseling, medications, etc. Oppositional defined disorders. Oppositional defined disorders, it is a condition in which it is mainly seen in the child. It is a conditions in which child display an ongoing patterns of angry, irritations, argumentative behaviors, violent towards the others, disturbs their normal daily activity, etc. The children with these disorders always tend to disturb those around them. It is a set of group of behavior disorders, and the cause of oppositional defined disorders may be due to genetic factors, physical factors, physical factors, psychological factors, if they do not have good relationship with the parents or his friend, etc. Social factors, due to social disturbance, etc. These are the some cause of oppositional defined disorders. And the symptoms of oppositional defined disorders, like fighting, refuse to obey instructions, frequent frustration, aggressive natures, um, without thinking, um, annoying, etc. And the management technique, like by counseling, sympathy, attitude, social skill, medications, family therapy, etc. Next is obsessive compulsive disorders. Obsessive compulsive disorders is disorders caused in obsessive compulsive disorders, the persons, there is a unwanted thought in a person's. Okay, in obsessive compulsive disorders, it is a type of mental illness that cause unwanted thought in a person's mind. Therefore, to get a rid from this thought, a person do the same thing again and again, like opening the door, counting the thing again and again, etc. Symptoms like unable to control his thought, doing the same thing again and again, checking the things that he had done or not, etc. And the cause may be due to biological factors. The exact cause of obsessive compulsive disorders is still unknown, but the research studied that there may be due to the problems with the way one part of the brain send the information to the other part of the brain. And the management technique, like through medications, changing the lifestyle, etc. Now we have complete about the topic disability and disorders, in which we have discussed about disability, cause of disability and its type. Like disability, it is it is an impairment which does not permit an individual to perform his day-to-day activity in a normal way. Disability, it is mainly related to body part, and disability, it cannot be cured, and disability affect his normal functioning, uh, like if his any physical part is not working, then he may do then he is not able to do his normal work as the normal people do. And disability, it is permanent, it cannot be cured. Disorders, it is a problem or illness which affects someone's mind or body. It is mainly related to mental disability. Disorders disturb an individual performance and reduce the efficiency of the body. In the beginning, disorder seems to be normal, but if the cure is not taken, then disorders change into disability, and if it changes into disability, it cannot be cured. In the beginning, disorder seems to be normal, like eye uh, eye weakness, etc. The cause of disability may be due to genetic factors, which is inherited, which is passed from parents to their child. Environmental factors like accident, injury, etc., disease, etc. Cancer, diabetes, heart attack, um, etc. These are the some cause of disability. Type of disability, there are three types of disability: physical impairment, cognitive disability, intellectual disability. Physical impairment means the person is not able to use his body part. It is mainly related to musculoskeletal system. The person is not able to use his body part in a normal way, like he's not able to use his upper limb, lower limb, etc. His respiratory system, muscular system, etc. is affected. Cognitive disability, it is mainly related to neurological disorders in which the person face difficulty in uh, uh, he faced difficulty in storing, processing, and producing the information. Okay, the person faced difficulty in storing, processing, and producing the new information. It is of three types: mental disorders, hyperactivity, and dyslexia. Dyslexia means the person is not able to read, write, and speak. Intellectual disability, it is mainly related to intellectual disability. It is mainly related to intellectual and developmental disorders in which the person face difficulty in communicating, learning, problem solving, making the judgment, etc. Next is disorders. There are various type of disorders like attention deficit hyperactivity disorders, sensory processing disorders, autism spectrum disorders, etc. Attention deficit hyperactivity disorders, it is generally related to brain disorders in which the persons face difficulty in paying attention, hyperactivity, impulsivity, etc. The symptoms are inattention. The person is not able to pay attention. Hyperactivity. The person is not able to sit in one place for a long time. Is and um, impulsivity means making hasty actions that occurs in the movement, doing activity without thinking. Sensory processing disorders, it is disorders in which the persons face difficulty in receiving and responding the information that come in through the sense. The person's sense organs is no more responding. Symptoms like the person does not feel any pain, sense, touch, hearing, taste, etc. And the cause may be due to genetic factors, low birth weight, environmental factors, etc. And his management technique like changing his lifestyle, medications. Autism spectrum disorders, it is a developmental disorders in which the person faces difficulty in communicating and interacting with others. The symptoms like communication problem, language problems, unable to interact with the others. He faces difficulty in uh, interacting with the other problem, means social skill. um, he is unable to make eye contact with the other persons, etc. The people with autism spectrum disorder often have this characteristic like ongoing social problem like difficulty in communicating and interacting with other persons, repetitive behavior, doing the same thing again and again. He has limited interest, and the management technique, first causes due to genetic factors, environmental factors, low birth weight, brain injury, brain disease, etc. And the management technique like changing his lifestyle, behavior therapy, medications, etc. And oppositional defined disorders, it is a disorders which is mainly seen in the children's. The child display an ongoing patterns of angry, irritation, moods, argumentative behaviors, etc. And the symptoms of oppositional defined disorders like frightening, blaming others for their own mistake, failure to think before speaking, uh, argue often, blaming, making mistake, lose tempers, anxiety, want to take revenge, etc. And the cause may be genetic, low birth weight, brain injury, etc. And the treatment are behavior therapy, family therapy, changing his lifestyle, social skill, motivation, etc. Next is obsessive compulsive disorders. Obsessive compulsive disorders, it is a types of mental disorders that cause it is a type of mental illness that cause unwanted thought. Therefore, to get a rid from this thought, he do the same thing again and again. Like symptoms like doing the activity again and again, checking the door that he has closed or not, washing the hand again and again, etc. And management technique, the exact causes unknown, and the management technique like behavior therapy, changing the lifestyle, medications, etc. Next is disability etiquette. Disability etiquette is a set of guidelines how to deal with a disabled person. Okay, disability etiquette is a set of guidelines to how to deal with a disabled persons. Some disability etiquettes like talk directly. Talk directly whenever you meet with a disabled person. Talk directly to the disabled persons, not with the person who is with him. Offer to shake hand. Explain before talking with him. Ask before help. Before helping, ask him whether he want help or not. Address him by his first name as we do with the other person. Don't touch his wheelchairs. Listen them carefully. If he has problem in language problem, then listen carefully. Don't make the correction in between. First, give the chance to complete his thought, his idea. Offers for help. Speak clearly, slowly, and use sign language if he is not able to hear. And relax. Feel relaxed whenever you help the disabled person. These are the some disability etiquette.